Tom Williams, Public Health, and Sherry Dawson, Behavioral Health. And this is really a fantastic team that's been working on improving lives of Nebraskans. So if you look back across the year, let's take Access Nebraska. In August of 2014, it was taking us nearly 24 minutes to answer the phone, and sometimes it was taking us 40 days to process a SNAP application, that Supplemental Nutritional Assistance Program. But because we've focused on process improvement and how we improve the services, we have improved that to hit our goal of 5 minutes or less, 12 out of the last 13 months, rather than that 24 minutes back in August of 2014. We brought our average time to process those SNAP applications under our goal of 10 days or less. Some months we've hit as low as 7 days. And our national rank has improved from 48 to 15. That is tremendous improvement, and not just improvement, but sustained improvement in Access Nebraska. It's a great example. We've also looked to become more effective and more efficient, more customer focused, and really try to reduce the regulatory complexity. And we see that reflected in places such as our licensure. So for example, for medication aids, we've taken the time to get that license from 39 days down to 9 days. In our nurse licensing, November 2015, we were at 96 days. This past June, and June is really kind of a peak time as people graduate, we reduced that time to turn on nurse licensing down to 63 days. So really fantastic accomplishments there. In developmental disabilities, we've done the same thing as far as streamlining. We've taken our application for those families to apply for developmental disabilities from 14 pages down to 3 pages. And that's allowed us to really reduce the amount of time it takes for those families to get an answer on that, whether they qualify for developmental disabilities, from 69 days down to 14 days. And great work by the Department of Developmental Disabilities to make that process easy. If you look at in our behavioral health, Sherry Dawson has been focusing on really integrating all the different services to provide our children the behavioral health needs they have, provide for the behavioral needs they have through the system of care. And really working to bring all the partners together to take care of our kids with the ultimate goal of reducing the amount of time that they are out of school, reducing the amount of time that they're away from having their lives proceed as every other child would. And also, this past year, we've rolled out our system-wide critical service program for the first time, having a statewide program to be able to address those needs. So again, great progress there. And then of course, in the area of Medicaid, this year we rolled out our Heritage Health Program to manage the physical, behavioral, and pharmaceutical needs of the customers we serve on Medicaid, bringing those all together in a managed care program. And again, there's a lot of great benefits in bringing really taking that holistic approach. Also, our companies that are working to provide that in May and June have been able to make sure they've met their goals. So their baseline in the contract is 90% of clean claims are paid within 15 days. And in May and June, they have been at 97% of those clean claims being paid in 15 days. So again, we've seen great progress there as well on how we deliver those services. In fact, talking to other states around the country, we know that our implementation of that managed care has gone just about as well as any state in the country. In fact, we're much improved over a number of different states on how that all gets implemented. So you can see we've had a lot of great successes in health and human services. But we want to have a culture of continuous improvement. And so that's what this second business plan is about. Building on the great successes we have had over the last year, all the things we've worked on in that business plan, and using that as a foundation, taking it to the next level. And so that's what Courtney Phillips, our CEO, is going to talk about today. What's in our next business plan? What's in our second annual business plan for this next year with regard to how we're going to continue to improve the lives of Nebraskans. So with that, Courtney, I'm going to turn it over to you.
Thank you, Governor. Good morning, everyone. First, I want to start off by thanking the Governor for his support and his encouragement for us to continue to focus on measures. Last year's business plan demonstrated a new level of transparency and accountability for the department. It set out clear priorities, fostered collaboration, and helped us to develop tools to hold ourselves accountable to each other, the taxpayers, and to those that we serve. Our success is a result of the dedicated work of our entire team. This year's plan outlined, entitled Good Life, Good Mission, Helping People Live Better Lives. When Governor Ricketts launched the new state branding campaign nearly a year ago, each agency had the opportunity to pick its own great word. For us at DHHS, the choice was clear. Good life, great mission. Mission embodies the commitment of our team and what we do on a daily basis. It drives us and inspires us as we continue our journey on improvements to become a more effective and customer service orientation department. Our work is to better work together, and we're doing that every day for a common and shared purpose. The current plan, as the governor mentioned, outlines 20 priority initiatives for this coming year. It clearly defines our goals, identifies our deliverables, and really compels us to continue measuring our progress as a department. Once again, they represent the work across DHHS and are grouped within the same 5 categories that are outlined in last year's business plan. Integrating services and partnerships, promoting independence through community-based services, focusing on prevention to change lives, leveraging technology to increase effectiveness, and increasing operating efficiencies and improvements. Our initiatives will continue to build on the progress we made on some of last year's initiatives and priorities, while others provide new opportunities for the department and ultimately for those that we serve. For example, one of the new strategies is keeping families together. This initiative combines and expands our SNAP DOL employment pilot project that we explained a couple of weeks ago. We currently, within that pilot, helped individuals who are currently working and receiving SNAP benefits to become more self-sufficient by helping them to achieve higher paying employment opportunities and receive benefits or increase or better hours to maintain their family's unit. We'll expand from the Grand Island area to Hastings, Columbus, and Norfolk. Another opportunity that our team has in this current business plan is to continue to streamline our developmental disability continuum. As the governor mentioned, we focused on initially our application. Now we're looking at our application process, and we're looking at shifting from our application to the actual implementation of services, and looking at how do we move that to a 60-day time frame. A new initiative that we're looking at in the business plan is the Nebraska Caregiver Responsibility Tools. One of the things that we continue to hear as we're on the road talking to our team members and families of those who assist us in serving individuals is the time it takes in our paper processes. And the Nebraska Caregiver Responsibility Tool is one of the initiatives that will help combat that. This tool actually works with our case managers and foster care families to initiate in terms of the time it takes to do a level of care determination and the rate of a foster care payment. Currently, our entire process is paper. This tool will allow our caseworkers to actually enter information via their telephone and mobile app while they're in the homes working with the families, rather than the paper process of filling out in the home, going back to the office and inputting the data. This will shave off more than 15 minutes per survey, and we currently do more than 700 surveys a month, which will ultimately save about 175 hours per month for our team members to actually spend quality time with the family versus doing paperwork. Another initiative that we have is the web portal through the central registry within CFS. And we're looking at this to replace our current process. We've heard from business vendors in terms of the time it takes for us to turn around these central registry reviews. So we're looking at implementing this web portal where individuals can actually submit their information, and we will have a quicker turnaround time from 4 to 5 days to 1 or 2 days in this particular initiative. I'm confident with the plan that we've outlined for this coming year and the continued enthusiasm from our talented team members that we will more than meet our intended goals and to continue to help our mission in terms of helping people live better lives. Each day we strive to provide strong customer service and a culture that is open to change and encourages ongoing improvement. By setting these goals and achieving these initiatives, we will work once again to position DHHS to continue to help people live better lives. Thank you.
Great, thank you very much, Courtney. And again, I appreciate the work of you and your entire team on